Hello, everybody. Welcome back to another episode of On Call Medicine Podcast. I am Dr. Todd, one half of your host, with my good friend today and always, Phil.
As always,
Welcome, Phil. How are we feeling today?
we're feeling pretty good.
Good.
Feeling pretty good. How about yourself?
Oh, can't complain. It's cold outside. It's warm
very
in
cool.
here.
Yeah.
So I thought perfect day to get together and talk about something that I see. Well, let's say this is a little bit more of a we'll say socially provocative topic.
Okay.
We may ruffle a few feathers here, depending on
That's
I
always
suppose
fun.
which side you fall onto here. But going to talk about corporate wellness programs, maybe the truth of corporate wellness programs, why they
Okay.
work and why they often fail. So I think this is going to be hopefully a bit of a thought provoking episode. What are your thoughts? What comes to mind when we talk about corporate health programs?
I'm going to be honest with you. What comes to my mind is a lot of training sessions,
Yeah, yeah, extra meetings.
extra meetings, extra meetings. This could have been in an email that I read, but no.
Without question, I think a lot of times it can be these kind of check boxes, as I like to call them.
Right.
These are things that a lot of, unfortunately, things that maybe aren't bad intended, but the way that they're delivered are oftentimes pretty hollow and pretty shallow.
Pretty stale.
Exactly. And I think this hits on, so this is actually a topic I'm fairly passionate about. When I was in residency, I was part of this national initiative through my residency program where we actually got together quarterly with other academic institutions in the country. So we would travel around, which was a lot of fun. I went to San Diego, went to Denver, I went to Chicago for it. And it was a great time, but we were focusing specifically on physician or really clinician burnout. So
Okay.
wellness and burnout, because this is something in the medical field that is, frankly, it's like a wildfire that's gone crazy. And I think that we're seeing more and more physicians leave the field of medicine due to things surrounding burnout. We're seeing nurses leave the profession for things surrounding burnout. And I think we see it too in the non-medical field. I think we're seeing people really upset, really frustrated with their jobs. Actually, I was reading it was a Gallup poll in I believe it was the Wall Street Journal, that showed that it was about 50% of employees were unhappy with their current job and actually were seeking alternative employment. That's staggeringly high. I mean, one out of every two people is unhappy enough to want to change it. So this is a big problem, I think, that's plaguing a lot of folks. I'd be interested maybe to hear feedback from our listeners on maybe some of the specific nuances of their profession, things that are frustrating them. But then also, of course, I can maybe touch base a little bit on what I see in the medical world. But it's very interesting. And I think it's got people pretty passionate.
That is, yeah, that's got to be an understatement because I know that's always a big discussion amongst people, especially amongst coworkers. Is I remember a job I had once upon a time to where that was just a recurring joke for us is going to sit down and have a nice breakfast at Perkins as you're going through the one. Now this is back in the days of newspapers, before everything was just acquired from picking up your phone and looking at the news. But burnout is always a thing. It's always been a thing, I feel like, but I feel like it's becoming a lot more commonplace. I mean, I didn't realize that it was up to the point of what you're saying about 50%. And that's a pretty staggering numbers, especially when you're considering, vital fields like healthcare and services that are designed to help people in danger, firefighters, police, ambulance.
Sure.
Folks like those.
Right. I mean, we relying upon these. Frankly, every field we are relying upon for the services that they produce, and yeah, I think if you see that, if we continue at this rate, I'm worried. What the future looks like, certainly in the world of healthcare, because like we touched on maybe I think it was our very first episode where we talked about primary care, and we talked about how 1 in 3 people in this country do not have a primary care doctor. Right. So there's already a massive need for more primary care physicians. And yet, as we move forward, as these burnout rates tend to rise, I do worry that will just further compound that problem to where now, it's one and a half for every, third person. So that does worry me a little bit. And I think part of our discussion today was we're not trying to build Rome today.
Right.
Certainly, I wish I could, but and we know that our listeners out there or people who are viewing this, probably are not in a position where maybe they're going to challenge the corporate pedigree. But can we come up with any strategies on our end, maybe to help combat it a little bit? And maybe take back a little bit of control too. I think that's really maybe the focus of this discussion today. And so I'm hoping this goes somewhere that people find useful.
Indeed. Well, let's dive right into it. Tell me some of your thoughts in regards to things of, what might lead up to that? What can cause a kind of burnout?
Yeah. So it's interesting. So most people point to financial reasons, and I think that the evidence will suggest that does play a role. But interestingly, it's not the whole piece of the pie. So you can still get paid maybe what you consider to be appropriately, and still certainly have a lot of discontent for what you're doing. And so a lot of that goes back to the workload itself and that feeling of, quote, autonomy. How much control do you have over the work that you're doing? And so workloads, as those increase, and as we've seen, over the course of, say, COVID, there was a lot of businesses lost money. A lot of corporations lost money. There was strategic changes to recover a lot of that. And so, frankly, a lot of that put extra pressure and extra work on the people that were there working. And so that creates this huge frustration because people feel like maybe they're falling behind. They have more and more oversight on them, telling them what to do and how to do it and how quickly to do it. And frankly, that leads to obviously a high degree of dissatisfaction. And what I see maybe in the medical community is I guess kind of the same thing. You have, because of that severe shortage of doctors, we are trying to see as many patients as we can. But I can tell you that's not necessarily always ideal for that patient interaction. I would love to be able to spend an hour with say every patient. Because one of the common things I hear, and I'm sure you've heard this, is actually kind of becomes a little bit of a joke, where patients will say, yeah, the doctor walked into the room and they had one foot in the doorway the whole time.
Right.
They were in, they were out, they didn't look at you, they sat and typed in their computer the whole time. And that depersonalization of medicine is a thing. And now I'm pretty happy with the way I operate my practice. I feel my patients thankfully tend to tell me that they actually are grateful for the amount of time that we'll spend together.
That's amazing.
And that's something that I'm very proud of and hold near and dear. So I hope, I'm sure like anything, I'm sure somebody has probably felt contrary to that, but I hope that that's something I convey, because I certainly want to. But I do understand on one end of that, on that stick, there is that overwhelming pressure that's coming down to, hey, we need to see more and more. We need to get as many in as we can, because frankly, wait times to see doctors and all, these things are exploding in terms of size. In the way the current health system is set up, it really can't handle that. And so obviously, as a practitioner, you feel the pressure of that. You're trying to satisfy, your employer. You're trying to satisfy the patient, and obviously at the end of the day, the patient should come first. But you're trying to satisfy all of these things, but it can be at a detriment of your own, say, personal satisfaction. And that's where I think maybe we see it perhaps more on maybe the provider side. But yeah, I think we see it on really across all fields. People generally speaking are just not happy with their current role. And I've never found it to be great advice. So if I see, if I have a patient come in and tell me that they're just going on about the work stressors and the deadlines, and maybe their supervisors are unrealistic and all these things, I've never found it to be super useful to say, oh, hey, you just need to change jobs, right? That's a lot easier said than done.
Right.
But
in a lot of different aspects.
Right. Exactly. Because there's financial constraints there. Perhaps you have retirement accounts and all these things these aren't very easy to just roll over. But I will say though, if you're out there and you are dissatisfied, I think that it doesn't hurt to at least start to think about those possible, say, ways out. Think of what you could do. Think of how you might strategize to make that become a reality, and then get some feedback from others around you. I mean, use your find your tribe, so to speak, right? I don't think that those. I don't think that that's bad advice. Certainly, it can be a lot to try to undertake.
Right. So I see it from a few different aspects. Obviously, I don't have the experience in the medical field that you do, not having any medical training or anything. But I've seen definitely in the corporate level situations to where, especially nowadays, it seems like it's becoming a lot more commonplace. People feel the dissatisfaction, and they're saying, you know what, I don't need this, and I can get it. I can see where it could seem at times to a higher entity, a corporate, you're just a machine in the cog. You're a cog in the machine. You're there to try and keep things moving along, and people don't have any kind of control or autonomy. They're there to work, and they get burnt out, and they're saying, you know what, I don't need this. I'm going to go take this another opportunity somewhere else.
Yeah,
I think, like you said, you should find your place and the best fit for you. And I can also see how that creates burnout, because you have a situation to where there's a vacuum created because of a loss of a person. So then they take that workload and distribute it to the people that are still existing,
yeah,
which will then cause them to feel more of the pressure and more burnout.
yeah.
But that's not to say that don't let that be a hindrance. If you need to find another opportunity somewhere else, by all means. But then I can only imagine how much more so that becomes pressure in the medical field, to where, you've spent this much time developing that relationship with clientele and with your patients, and to be able to just simply pack up and say, you know what, I'm going to go ahead and I'm going to sell insurance, and I'm going to be a door-to-door insurance salesman. Not you know what I'm getting
Sure.
at. To basically just kind of pack up and move on to something else. That's not easy.
No,
in
it's
itself. So there's a lot of different aspects to consider in this.
Oh, it is extremely hard, and you hit it completely right on the head there, and that is especially from the physician aspect. You do have that relationship, that loyalty to your patients. So I do think it's hard for physicians to ultimately take that step, maybe take that leap. I do see physicians sometimes, though, maybe adjusting the scope of their practice to help accommodate that. And this is something that actually I think is a very good thing to recognize. If you have the capability to do this, setting boundaries, right? Because at the end of the day, we all deserve to have that free time with family, time where we are able to detether ourselves from the workload, of our occupation. And we all deserve that. Hence what we're doing here, right? This is something that I find enjoyable, that I want to do, right? A little bit. And granted, we're spending some of this time talking about topics that are maybe I approach an every day, but getting to do it in somewhat of an unfiltered way too, where it's nice. There's not the time constraints of the day necessarily affecting us. But I think I think where a lot of, say, corporations miss the mark is they sort of dangle superficial things in front of us as sort of your wellness package. Things like perhaps maybe they provide a discounted rate to like a gym membership, which isn't a bad perk, but it's pretty hard to use if you're at work, 10 or 12 hours a day, and
Right.
you're behind on work, so you have to bring it home with you. Pretty hard to use that, and it's pretty hard to get adequate sleep and all of these things that are so important and crucial for wellness. And so, and something I remember, I remember going into these meetings when I was in my training, and they would bring somebody from like our corporate wellness initiative, and they talk about, hey, do yoga and do deep breathing exercises, and I was always, it always kind of made me laugh, because I was like, okay, well, we got up at 5 a.m. to come to this meeting before diving into our patient care activities to be told to do yoga. And I was like, well, I would have probably rather had that hour of sleep so that I could recharge. And then the other thing that I think is frustrating And that's not to say that there's no value in it, but there's this concept of resiliency training, and this has actually become somewhat of a almost a gaffe in the medical world, because it's so widely talked about.
Mm-hmm.
And what resiliency training is, for those who maybe have never heard that term, it's basically kind of as it sounds. How do we develop strategies to become more resilient, and how to deal with the struggles that in front of us a little bit better, which are not intrinsically bad things to try to learn,
Sure.
but it completely misses the mark because it says, okay, well, if we have a problem, and let's say that problem is somewhat institutionalized here,
Mm-hmm.
well, instead of fixing the problem, let's just make people deal with it better. It's like, well, that is, to me, that is ridiculous. I mean, it completely misses the mark. If there's a problem, you identify the problem and you try to fix the problem.
Right.
You don't make people just accept it better, or find strategies to overcome some of that.
And just put up with it more.
Right. I think, and that's why the data on resiliency training is so, really, it's so all over the place, because
Mhm.
it's, while maybe some evidence suggests that there's some benefit to it, a lot of evidence actually suggests quite the contrary, which is probably what you'd expect. Like, at its core, is it bad advice? Well, probably not, but it certainly doesn't solve the problem at play here. And then I think this kind of segues maybe into maybe that deeper element here is burnout. Generally speaking, is it comes with a degree of unhappiness.
Right.
Right. It's unhappy with your job. Typically, burnout is starts with your occupation, but that can carry over into your home life.
Mhm.
It can affect relationships. It can affect the type of partner you are, the type of parent you are. It can increase anxiety. It can increase rates of depression. And then we get into, even a step further than that, suicide rates. And so this was something when I was in residency and we were working on this national initiative to help reduce some of that burnout. This was really the thing that I wanted to focus on. Like, how do we, I was looking at it from the physician side, but how do we reduce the rates of that? Because, I don't know if you'd be surprised to hear this or not, maybe not. But suicide rates as a profession are highest in healthcare professionals. So,
Did not know that.
and that is something that we see, and it's not just doctors, doctors and nurses and people involved in patient care. But suicide rates are amongst the highest, with some other, say, military, service folks, PTSD. Actually, interestingly, construction workers, so some trades folks tend to fall in this list. That tends to be more just by maybe the sheer size of those. Say, like, if you were to look at folks employed in, say, construction work across, say, the country, it's going to be a lot higher number maybe than those implied in, say, postal workers or things like that. But the point is, not diminishing any of this. The
Sure.
point is that stress, the pressure cooker, if you will, feeling of unhappiness, feeling of isolation. These are all things that we see develop with burnout, and unfortunately, sometimes we see it take that next step to where folks are actually considering ending their life as a result of this. So that's why I'm so passionate about this topic, because I don't want to see that. I know you don't want to see that. I can imagine anybody watching this or listening would want to see that. So I guess the question is, well, then what do we do about it?
That is a really good question, because that's something that kind of swims around in my mind. Because, to be honest with you, from what I had seen in my previous experiences with corporate roles or sales roles that I've had in my past, it's almost approached with it over a bullet hole kind of an approach. There might be some kind of a form that they construct, or a brief training that they do. And it's really, it's almost like they're just, like you mentioned, kind of checking off a box. They've made a checklist of, well, how do we make it look like we've dealt with this, apparently. And I'm not trying to insinuate that that's their only goal, is to try and just for appearances. But there are times where it can kind of feel like, hey, we're addressing this. We know that it's an issue. Here's how we're addressing this. We're going to get everybody together and we're going to go through this corporate training. Or, hey, guess what? Good news. Pizza party. Everybody loves those.
Yeah.
But it does bring into the fray of I don't even know if I use that word right.
That sounded good to me.
Thank you. We're just going to roll with it.
That's
We're
right.
just gonna roll with it. Kind of brings into light of how do we adequately deal with it? Because while at times it can seem like they're coming up with these temporary fixed strategies, there is at least an acknowledgement that this can be a real big thing. And I see burnout all the time with with sales, and I've seen how detrimental to somebody's mental state of health that it can be. So how do we deal with these aspects of burnout?
Yeah, and
that?
yeah, and it's hard because obviously so sometimes we're fighting a kind of a nameless, faceless adversary, right? Because especially when we get into these large corporations, we don't even always know who would we even direct some of these concerns to, and so that can be challenging. And I think if there's anybody listening who's maybe say more on the corporate side, these folks have a very difficult job as well. And I think recognizing that there's a pressure really on all of them and us, and so I think you're right. Oftentimes the pizza parties, the whatever Hawaiian shirt Friday kind of things.
The staff mixer,
Exactly. While I was kind of referred to those as like forced fun,
yeah, exactly.
I'm not saying that those are bad, and I'm not saying that those are intrinsically wrong ideas. I do think having, say, morale and boosting interaction between, say whether it's your employees or your staff or whoever the case may be, those aren't bad. But I think what I would love to see, and I suppose if anybody's out there listening who's maybe is on more of the corporate side, what I would love to see though is touch base with folks periodically. Listen to what they have to say, listen to their concerns, and check back in. Because oftentimes if there's a concern displayed on surveys, for example, because these are commonly used in corporate world, send out these satisfaction surveys. And if they're like consistently getting terrible reviews, listen to that. Take that into account, that this is the experience of the people who are really our most valuable asset, right? I mean, in any corporation, the most valuable asset are the people who are doing the work. So listen to that and touch base again and say, hey, we've done these things. What do you think? And if you miss the mark, they'll tell you, as long as they have confidence in that you're trying to help, they'll tell you, and make it more than just hey, we're gonna have this mixer, or we're gonna give you this whatever, this hat to wear on Fridays. Because what we've seen in some places that have tried to do this,
there's a corporate stress ball.
Exactly, with the logo of your company on it too, right? So you can stare at it and squeeze it. We are seeing some people trying, or some entities trying this. So Iceland, for example, and I don't know precisely to what degree or what sectors of their of employment they tried this in, or if it was just across the board. But they actually adopted a 4-day work week, in an effort to, say, reduce sense of burnout, reduce some of that overwork nature, and that had, as you can imagine, fantastic results.
I can believe it.
And actually increased productivity. So it turns out sometimes less is more. And so cutting back and increased productivity, increased satisfaction, and everybody's happy in the medical world. So I believe it was Mayo Clinic. It could be wrong about that, but I think this was an article that I read in the JAMA, which is the Journal of American Medical Academy, or Medical Association, sorry. So JAMA article about, I believe it was Mayo that provided medical scribes for all of their providers. So what that might mean, if anybody's not familiar quite with what that term is or how that would apply to the medical field, one of the burdens that physicians do complain about is some of their own administrative burdens. So seeing the patient, and then turning around and doing all of the, say, paperwork, so to speak.
The back end work.
Exactly, like the clinical documentation element, because that takes time. And so they found that providing these scribes actually reduced burnout and improved satisfaction rates amongst the physicians by about 70%. So it turns out giving doctors more time to focus on the patient specifically the patient, and less of that, worry about, say, clinical documentation stuff, actually improved satisfaction quite a bit. Now, my thought, which perhaps somebody out there is thinking, okay, well, was there a drop off in clinical documentation that was potentially concerning or detrimental to the patient based on that, right? Because obviously that is, not every action has an equal and opposite reaction, so to speak, following Newton's law. But actually the study found that no, there was zero drop off in, say, accuracy, or because frankly, what the Scribes are doing is they're really just reiterating what the doctor's saying.
Sure.
They're just doing it for them. And so there was absolutely no drop off in accuracy or safety. And so this is big. So then my question, why isn't this being done across the board? Right. Because it's not. And part of the reason for that is, well, sadly, as most things are, it's financial. So that becomes a financial strain on the system to have to accommodate that. Now, personally, I think that that's something that should be worked through. That should be accounted for, because again, at the end of the day, a higher satisfied physician likely indicates better patient care deliverance.
It just kind of filters down.
Exactly. And I think, while I maybe can't cite specific studies that show that, I can almost promise you they're out there. And so I do think that would be maybe one element that I'd like to see, certainly in my field, where, because again, we kind of pride ourselves in medicine is recognizing data, following data, implementing data. Well, I think that's some data that needs to be implemented personally.
I mean, there's a lot of different aspects to consider on that. And so, we've covered, some thoughts as to how we can kind of work towards correcting that, recognizing it. How about this? How can somebody that feels themselves in a situation of burnout, how do they cope? How do they figure out for themselves, is this something that I should continue and maybe work my way through, build up that resistance and push on through? Or is it, better to kind of look at an alternative option?
Sure. I think in this, it'll be hard maybe to come up with a one size fits all for this, but one of the questions that I actually maybe typically ask a patient is, well, what's the prospect for improvement? Because certainly we'll see scenarios where maybe we go through a rough patch. Maybe it's this, this time of year tends to be rough, but hey, here in another month, they hired 2 or 3 new people. They're training them. Once we get all this sort of, once we get the weeds sorted out here, everything's going to be good. So if the prospect for improvement is there, and this is maybe true not just with your employment, but perhaps with stressors at home. People coming in saying they're overwhelmed by all of this stuff that's going on around them. Well, what's the short-term outlook look like? What's the long-term outlook look like? Because I think that helps maybe put it into perspective a little bit. Because if there is anticipated improvement, well then sometimes, yes, this is where maybe resiliency training could be useful, because we're sort of buying time a little bit.
Sure.
Now, if the prospect for improvement is not there, if it's, look, this is the way it's been for 10 years, it's not getting better, it's getting worse. Every time we bring this up, it gets shut down. Every time I do this, it gets shut down. Well, if there's no prospect for benefit or improvement, well, then we do have to have a really long, deep look and look in the mirror there and say, okay, am I satisfied with this? And if I had to deal with this for the next, say, 10, 20 years, could I? And probably the answer is no. And so I think at that point, you owe it to yourself, you owe it to your relationships, your family, your overall health, to at least explore those alternative options out there. And I get that that's hard, and that it can sometimes seem impossible. But I think you at least you owe it to yourself. Sometimes it's a matter of taking a gamble on yourself too. Saying, hey, you know what, I'm capable of doing this. Maybe I haven't done it because of XYZ reasons, whatever the case may be. And maybe a little bit of a, shameful plug on our episode that we talked about about some of the reasons people give up on their dreams and how to
Mhm.
maintain motivation and sort of the face of adversity. Go check that episode out. I mean,
Absolutely. There's no shame in plugging
right,
at
because we
our
talk
episodes here.
about that.
Absolutely.
How do we find that drive? How do we overcome some of those obstacles? Because there absolutely will be obstacles. I guess maybe somewhat in closing here, my advice to anybody who's watching, anyone who's listening, is do not settle. We only get one trip around this earth here.
Mhm.
Life is far too short. Don't settle. Um, if find whatever gives you that passion, whatever gives you that burning to move forward. And sometimes maybe it's just developing an outlet from the stressors there, right? And so if you're not feeling completely satisfied, adopt something else. It doesn't mean you necessarily have to quit.
Right.
But hey, start a podcast, right? Start a blog. By the way, we're not doing this because of any burnout.
No, no.
That's not to say that certainly the strains of every day don't always obviously can impact us. Absolutely. But truly the goal of this for me and for us, I think, was to have a platform to try to share ideas and help as many people as we can.
Mhm.
Because believe it or not, as we hope we're helping folks, it's having the same impact on us. I mean,
Absolutely.
this is there's an expression that the rising tide raises all ships, right? I think that our goal with this is to be the tide, right? To elevate everybody,
Everybody.
to something perhaps that they weren't aware that they could become. So, I guess that's my soapbox for the day. I hope you enjoyed it. I don't know, any closing thoughts, Phil?
I honestly, I want to defer those closing costs to our viewers. As always, if you're enjoying what you've heard, we'd love to have you join us, follow, click the like button, subscribe. But also, we like to hear the feedback from you. So if you're in situations to where you're experiencing burnout, if you're having gone through burnout and you found a way to kind of overcome, we want to hear these kind of stories. We want to hear questions you may have. So please, by all means, don't hesitate to reach out. But other than that, it's been a pleasure to have another
Yeah,
opportunity to speak with you.
actually, Phil, you said something I think is there that I loved, by the way.
Okay, let's go with it.
And I also kind of wanted to piggyback on that because I think that is so true. If you have overcome, if you're listening or you're watching and you have overcome some of these struggles yourself, we want to know that because one of the things that I do in my everyday practice is while, bread and butter textbook medical, say, diseases and ailments and treatments, that's a part of my day. But another part of my day sometimes is just giving advice on things like this. And there's maybe no textbook to tell you how to do that.
Right.
And so,
Because it's not one size fits all.
exactly, because it's not one size fits all. So sometimes I will hear what people tell me and that resonates with me. And I'm like, oh, okay. So they may not know it, but they actually helped me through something maybe I'm dealing with. And if we can hear all that, compile all of that, then that's just more ammunition for all of us, right? So please do share some of those strategies that you've deployed because maybe they'll help you and I, and maybe they'll help everybody else who's potentially watching and listening.
Absolutely.
So, like I said, rising tide raises all ships. We're all in this together.
All right. Well, it's been a pleasure. As always, love having any opportunity to talk to you about these things. So, in closing, I'd like to say thanks for joining us. And as always, live well.
Live well.